as we go into this season. I would like to thank Oley for the opportunity to do this encore presentation that Carol and I were fortunate enough to do at the previous Oley meeting. I'm going to stop my video now so that I can concentrate on the talk. And I'd like to do the next slide. I'm going to start this talk because we're having a little bit of a technical issue with Carol's sound, and that'll give her the opportunity to fix that. So here are our disclosures. As Andrea mentioned, I do some part-time consulting, and these are the companies I work with, and you can see Carol's here as well. Next slide, please. So for this particular session, we have an hour. We want to allow for quite a bit of time for questions, but our main goal here is to help you sort out routine from urgent and emergent problems when you're talking about someone who is receiving an enteral feeding via a long-term feeding tube. And look at some of the causes of these situations, and then explain what can be done to prevent the problems and then how to deal with them. And certainly with enteral feeding problems as well, because we know that there's not just problems with the G-tube, but people have trouble, tolerating their feeds on occasion or chronically. Next slide, please. And okay, great, thank you. So we wanted to start really with some definitions so we're all on the same page. And I have vetted these definitions kind of around in Europe and in the US and Canada to make sure that pediatric gastroenterologists, interventional radiologists, people that deal with G-tubes on a chronic basis, gastroenterologists agree with these definitions. So here they are. A routine situation is something that just can happen, like redness, some drainage. The treatment can be done at home if we tell you how to do it properly, and you should expect it. None of these feedings go 100% all the time without some bumps in the road, and we need to expect that. So routine things are things that we want you to handle at home, but we need to give you good information, solid information about how to do that. I will just tell you, as an aside, that as a nurse, I have learned how to handle some of these problems from patients and their families themselves. So sharing that information is a good thing, and I'm sure at the end of this, we'll be doing some of that. Urgent situations actually often are a continuation of a routine problem that hasn't been addressed, or it gets worse with time. And that doesn't mean you didn't try to deal with it at home and do the best you could, but it just defied whatever you did. And now the healthcare team needs to get involved. And so you need to call your healthcare provider and probably get a clinic visit, perhaps not the next day, but time will be an issue here. An emergent problem is a serious problem. It requires immediate access to healthcare, either an immediate visit in the emergency department or in a clinic or an admission to the hospital. And emergent implies that if it is not taken care of, life-threatening sequelae or consequences could occur. So those are our definitions. Now let's delve into this a little bit more. Next slide, please. Okay, so now the urgent and emergent. Sometimes this is a definition that is kind of on a spectrum, right? Where you start with routine and it just keeps going down the scale. So what makes something go from urgent to emergent? And these are, again, some things that I have asked people that I work with around the country on projects, what they think about it. And we all agree it's the rate of the change. If that G-tube wasn't red in the morning and it's bright red in the evening and the next morning there's kind of a little knot right there, that's a problem. The timing of the change in conjunction with feeding intolerance. So, if the patient, if you you are tolerating your feeds fine, and then something happens with your G-tube, maybe some purulent drainage, maybe a lot of leaking, something like that. That's important. Anything that interrupts adequate nutrition is important. It may not be urgent or emergent, but it is important. The severity of the sign, a pus pouring out of a G-tube, blood pouring out around the G-tube. These are very severe things. Associated signs, difficulty breathing, tense abdomen, firm abdomen, distended abdomen, changing overall color, kind of a grayishness around the mouth. Those associated signs, wow, that is a 911 call. Concomitant signs indicating clinical deterioration, and I've told you some of those. Now, if you are the patient, you're going to know there's something very, very wrong. Now, what you need to figure out is, can you get yourself to the hospital yourself or with a family member, or do you need to call 911? Now, here is my take on that. Anything that is affecting breathing, your overall color, if you're turning kind of a bluish or a grayish or a bright red, or there's blood involved, or you can't move, your blood pressure is so low, call 911. That's just how it has to be. So these are things that can happen. We hope they don't. And I am not saying that they happen because signs were ignored. I'm saying that things can happen very quickly. As you heard in my introduction, my background is pediatrics. And the thing that I learned with children is that things go from bad to worse very quickly. Now, the good news is they go from bad to fairly good pretty quickly as well once we turn things around. So there's hope here. And I'm not trying to scare anyone. Next slide, please. Okay, so these are some of the routine problems. If you have a G-tube and you're on this call, my suspicion is that you've had more than one of these types of problems. So let's go through redness at the site. And that means that when you press on the redness, that it turns white. And then when you go up, it turns white, and that's okay. So if it doesn't blanch, that means you press on it, and when you go up, there's no blanching. That is a more urgent problem. So that's the redness. Leakage can be all kinds of stuff. We're going to talk about that. And if that G-tube is too loose and wobbly, particularly for those that are caregivers for someone with a low profile device, and those of you who are adults on this call, those low profile devices are becoming very popular among your group. And so it could be that you also have a low profile balloon device or non-balloon device. A side infection, talk about that, and a yeast infection, and then some granulation tissue, which seems to happen to a number of people with a G-tube. Next slide, please. Okay, now you can see here, you're going to see a lot of pictures, because I think we can all agree a picture is worth 1,000 words, right? So here we have some redness, and this doesn't look too bad. It can be just a normal reaction to a foreign body, particularly if the G-tube is newly placed. This stuff is going to blanch. You can see down in the lower part that there is, from a bolster, there's a stitch area that is kind of inflamed as well. That's going to get better with time. Now, sometimes with redness, soap actually is not a helper. And so what we would do is just clean it with water, or there are specific things that oftentimes wound and ostomy care nurses use to clean around an ostomy site that might be better and a little more gentle for this particular site, because what we don't want to do is irritate it more. Now, this should go on away on its own, but sometimes it doesn't. Sometimes it stays. And if it's not causing any trouble with the actual feeding, or it's not hurting or anything like that, okay, we're going to say, okay, that is just how I roll. I have some redness at my G-tube, and I'm going to live with it. Now, the one thing that is important is to avoid pulling on the tube, because that irritation, constant irritation, is not going to help. Now, adults are not going to pull on their tube, but things can pull their tube. So you do want to be a little careful about that. If you're not using the tube, take that extension set out. Sometimes people will attach the distal end of their tube, the dangler part, in their underwear or in a diaper tab so it doesn't get pulled. Okay, next slide, please. Okay, now leakage or drainage. I would imagine that there isn't anybody on this call who has a G tube or even a GJ tube that hasn't at some point had some leakage or drainage. So the one thing that I would say is that for the most part, it can be normal. Depends on what it looks like. Now, this looks rather normal. It's mucoid, and you can tell that because look at the yellowish crusting of it. And it's probably related to that granulation tissue right there. And therefore, you know exactly what needs to be done. That granulation tissue needs to be treated so that that drainage will go away. Now, it can be clear, and that would be the case of someone that has a really bad respiratory infection and is swallowing secretions. And while you think that you're blowing your nose all the time or that kind of thing, even children will swallow more saliva and secretions, and then they oftentimes will just kind of bubble up onto the abdomen because of the volume issue. Also, I will say that children who are teething are going to have more salivation, more saliva production, and they are going to have more drainage. For that reason, we would put a dressing around it at that point. The mucoid, you can see that here. Formula bubbling up. Now we would see this when someone goes to their clinic appointment and someone says, okay, you know what, you're doing great on your formula, your bolus feeding. Let's go from say 6 ounces to 8 ounces per feeding. And that's a great idea. I love that because we want to give the person enough time to grow and develop. This would be a child, of course. And so sometimes you can't go from 6 to 8 ounces at one fell swoop. Maybe you have to go from 6 to 6.5 or 6 to 7 and then 7 or 7.5 and then 8. So it may take a while, a few feeds to get there. And the key way you're going to know that is that when you give the feeding, toward the end of the feeding, formula bubbles up onto the abdomen, or the abdomen is very distended and the person acts like they are very uncomfortable. So just take a little time sometimes when you are advancing feeds. The provider will be fine with that, your healthcare provider. What's going to happen is that you want to let them know that it took you a little bit longer than you anticipated if it does in fact do that. Now, these are the things where you need to call your healthcare provider if it looks like pus. Now, sometimes that's hard to tell, right? Because formula sometimes looks like pus. I know it's kind of a disgusting thought, but it is true. If it has a greenish tint to it, now sometimes that's bile. And so you need to use a little bit of discernment. And I'm saying that because you guys are a sophisticated group. If you think it's got a greenish tint, it's got a funny, sweet smell to it, you need to call somebody. If it's black, absolutely, no question, you got to call somebody. Next slide, please. Okay, well, the G-tube is too loose. And this would be the case where you have a standard G-tube, sometimes people call it a dangler, and you have that external bolster, or you have a low-profile balloon G-tube. Of course, when you have a standard G-tube with a bolster, what you want to do is make sure that it lays flat on the abdomen and that there's some wiggle room so that air can get in underneath there. When we're talking about a low-profile balloon gastrostomy tube, Mickey Buttons and AMT mini ones are 2 of many brands I'm just throwing out there so that we kind of know specifically what I'm talking about. I'm not advocating either one or any. The tube is too wobbly or it sits up higher on the skin. The external bolster, that would be for the dangler, sits at an angle or it's not as tight. And then there's increased drainage on the skin, oftentimes formula. Now, this is a tough one because many of you in the audience have motility issues and you have times when your abdomen blows up like a balloon, for lack of a better way to put it. It blows up, you become distended. And at that time, you need that G-tube to be more comfortable. You don't want it too tight on the skin. So you may have to pull that bolster up. And as an adult, you can adjust that bolster to your comfort. And I encourage you to do that. But if you have a low profile balloon and a child, this is what we recommend. Check the water in the balloon if you've been instructed to do so. And if you do add more water, then recheck that water in a couple, 3 hours, because perhaps the balloon has one of those micro punctures where the acid in the stomach has kind of leaked in there and caused a little micro hole in there. And it could be a slow leak. And then the tube, in fact, needs to be replaced. So if the G tube is too loose, it may need more water. It may need to be replaced, but it needs to fit snugly so that we don't have leakage. Next slide, please. Okay, a minor site infection. Well, you see the signs here. Many of you have probably had it. Redness, tenderness, some drainage, but you don't have any other those concomitant signs that I was talking about earlier, which would be that knot, like a ball right there, fever or chills. Now, what we do here is we'll clean it 3 times a day with either just water or that cleanser that I was talking about, the wound and ostomy care nurses oftentimes use. Apply an over-the-counter antibiotic 3 times a day. If it gets better after 3 days, then I want you to use that for 10 days. If it's not better after 3 days, you need to call your healthcare provider, tell them what you've done. And then I want you to be careful with dressing use. By that, I mean, you may need to have a dressing on that G tube, and I get that, but do not place a dressing right after you put an antibiotic ointment. This should be an intuitive thing when I explain it. You don't want that antibiotic ointment to soak into the dressing. You want it to go on the skin and soak in. So leave anything off of the skin, such as a dressing or anything that will get right on the skin, for about 30 minutes. And then you can put a dressing on should you need one. Next one, next slide, please. Okay, a yeast infection. Now, I'm going to use this slide twice, so I want to differentiate a mild yeast infection from a more urgent situation. The top area that you see right here is what I would call an urgent situation. Look at this baby's around the belly button, the umbilicus, and then down onto the leg. That is a mild yeast infection. Now, a mild yeast infection can be treated rather effectively by, again, cleaning 3 times a day and use an over-the-counter antifungal cream. And you can look for these in the area of athletic creams or athlete's foot, things like that, a store brand or a name brand, either one. And you're going to put it on 3 times a day. So the other thing that this slide shows us is the difference between wet and dry yeast, because we treat them differently. Up at the top, that is wet yeast. Look at how red that is and kind of angry. Down below, that's dry. So the dry yeast, you're going to use a cream that will adhere. Up above, where it's wet yeast, you're going to use a powder, and you can see they've done that, so that it will actually sink into that irritated skin. Okay, next slide, please. So mild granulation tissue. So you want to clean the skin twice a day, but the main thing you want to do is make sure that G tube is the right size and it's not getting pulled on. So you're going to use an absorbent dressing, and it's got to be treated, or it's going to go from mild to moderate, which is an urgent call. Because granulation tissue can become infected, and then you have a bigger problem. So you want to use an absorbent dressing. I'm not going to leave a lot of names, but there are people that use these cotton dressings that have a little slit and then a tab or some Velcro to adhere them. I used to be against those. I have to tell you, I became a believer in using those those little felt dressings that are homemade. They will work as well, but you must treat mild granulation tissue. Now, oftentimes what we will do, and I'm going to name a product here, but I don't own any stock in it. We would use something like granulation. It's available on Amazon. You need to talk to your healthcare provider first, but you put it on 4 to 6 times a day. Protect the skin around that granulation tissue with Vaseline, Desitin, something like that, a barrier cream, and then put it on, and don't put a dressing around it, and it will shrink that granulation tissue. Now, if you are not wanting to purchase something, in the UK, the United Kingdom, and Australia, they will use some, again, barrier cream around the stoma site, and then they'll put regular table salt, like 1/4 of a teaspoon of table salt on there. That is going to sting. It's going to hurt a bit. It's not going to cost you much. And it will treat the granulation tissue. So if you are looking for information about this, look in the Google use of table salt, and you'll find some information from Australia, particularly in this area. It's quite popular. Okay, removing the extension set if you have one or if your child has one. Next slide, please. Okay, worsening redness. I think I need to probably pick up my pace, so I'm going to do that. Okay, these are the things that go from what I would say bad to worse. So here we go. Let's do the next slide so I can move on here. Okay, now we can all agree this is worsening redness. It's beyond the circumference of that tube. This, we would use a barrier cream if it was caused by leakage. You could try an antibiotic cream. I would look to see if it's blanching first. And then you want to use a dressing again with caution so it doesn't absorb the antibiotic. And if this does not get better in about 3 days with an antibiotic, you're going to need to call a healthcare provider on this. Next slide, please. Now, this is a very bad slide, and this is a patient who had neurologic impairment and was pulling at the G tube with the balloon fully inflated. So now you know we've got bad issues here. Worsening drainage, because this has been cleaned off, but you can see the mucoid drainage in the periphery on the slide on the right, a huge hole. And then notice this plaque on the slide in the left, the picture on the left, there's some white drainage down there in the bottom. That is a yeast infection that is developing. And so this situation is going to be dire. Now, we were not able to actually salvage this, I will be honest with you. But if you had a situation where you had worsening redness, treated it with an antibiotic ointment or something like that, you want to change out to a new G tube. Now, this site was non-salvageable, so please understand that. But a new G tube toward the end of that treatment, because bacteria grow into the outside and the inside and the tract of a stoma. And so they will invade that G tube that's there. And if we don't pull it out, say on day 7 of 10 days of antibiotics, once you stop the antibiotics, that irritation comes back. So this is a cardinal rule of treating any G tube with an antibiotic or antifungal. Change the tube toward the end of the treatment so that it doesn't reinfect itself. Next slide, please. Okay, worsening yeast infection, let's focus at the top. It goes down into the tract, and you can see that white stuff is doing it, and it's very macerated. So this, again, we have to change the G tube with the treatment. I would use a little bit of vinegar on this, and we have another slide on that. Next slide, please. Okay, look at these yeast buds inside this. This is disgusting, and many of you have had G tubes that have been kind of like cobbled or curdled in there. They have a white drainage, things like that. So let's be clear, yeast can go down the inside of the G tube as well, and they probably crawl up from the stomach. Can happen within a few months to years. So what we would do is put 10 mils of apple cider vinegar down the tube a couple times a day. It's kind of like using Italian salad dressing, although I'm not advocating at all Italian salad dressing. I am saying that anecdotally, which means that in my experience, which is pretty extensive, some vinegar down the tube, not white vinegar, that's too acidic. Apple cider vinegar twice a day can really prevent that. And then for children, you want to do 5 mils. And always, as was said in the introduction, anything that could be construed as healthcare advice, which this is, you want to check that out with your physician first. Okay, next slide, please. Clogged or cracked tubes. Well, that can be urgent or emergent, depending on if you cannot give life-saving meds or the feedings can't be given for quite a while. So you want to make sure that things are not getting clogged. So frequent flushing, and again, we used apple cider vinegar, particularly in J tubes, and that really cut down on our clogging. And it could be from yeast growing on the inside of the tube as well. Next slide, please. And this is why you need to flush well. And these were given to me by a colleague, Lauren Brewer from Cleveland Clinic. Next slide, please. Moderate granulation tissue is an extension of the mild. It just keeps going out farther. So we would use a silver ion dressing with this and the granulation, which I talked about, or a topical steroid cream, but only use that for 7 to 10 days. Don't keep using it until that tube is gone because it will break down the skin around the G-tube stoma. Next slide, please. Okay, now emergent problems. Okay, this is when you got to go. You've got to be admitted. That's just it. So let's go to the next slide, please. Okay, so if you can't rotate the tube, is it new or is it gradually developing? Look at the skin irritation around here and the black drainage. The skin irritation is because iron, which is from blood, is very irritating to the skin. You can see how this is tinted in. The tube is too tight and there's black drainage. There is a gastric mucosal ulcer right where that tube, the balloon, is in the stomach in this tube. Next slide, please. Okay, I'm going to talk a little bit about that previous slide. That tube, that child has to be admitted and has to have that tube changed under medical supervision. Do not change that tube yourself at home. A GI bleed, a serious one, could occur, and I've seen that happen in the hospital. Okay, severe cellulitis. This was caused by a reaction to an adhesive from a newly placed G-tube. Very, very sad deal. So there's no edge around this swelling, but a severe cellulitis or side infection, there could be like a knot underneath there, and that's just a collection of pus, honestly. And so this one needs to be seen in a clinic or an emergency department to be treated. This particular site was considered a chemical burn and had to be debrided a bit. And you also want to know if there's purulent drainage, fever, or you don't feel good. I'm telling you this because if you call your healthcare provider, these are the things you want to tell them. I don't feel good overall. I'm having some chills. I think I've got a fever. I think when I press on this, I get some pus out. You need to tell them these things. Next slide, please. This one is a tube that around the edge, you can see a rim. That is what used to be the stoma site. And due to not having this tube replaced and upsized, it wore a hole, and that white spot right there that we can see is the greater omentum of the stomach. And this tube should have been upsized. And so this is a case where it has to be, the child has to be hospitalized. And what we would try to do, although this one is beyond help at this point, is actually take that tube out a bit every day and try to shrink it down. But when the hole is this big, that's not possible. Next slide, please. Okay, Carol, can you do?
Yes, I hope that you can hear me. Can people hear me just fine?
Yes.
Okay, great. Well, as Beth mentioned, I'm Carol Ireton Jones. I am a registered dietitian, and I work with patients in the home care setting. I'm outpatient totally, no hospital, although I spent some time in the hospital, but I really enjoy working with all of you in the home setting. So now let's move on to sort of my area, which will deal with the formula and signs and symptoms that can be either routine, urgent, or emergent. So let's talk first about routine tube feeding problems. And of course, the first one, which I've had many calls about, I'm running low, or I ran out of tube feeding, or I received the wrong product. Maybe I have a product that didn't have fiber in it, and now for some reason, they look the same, but this one has fiber in it, or I didn't order this product. Why am I receiving this new product? Maybe there has been a recommendation made to change that, but you weren't aware of it. This is somewhere between a routine and urgent problem. So my first recommendation here is to contact your home infusion provider, home care provider, DME company. Find out, can they get formula to you quickly? What happened? Was it you? Did you not count correctly, or do you need? Did they just run out? What is the problem? So contact your home care provider. Now there are some options. There are many kind of simple over-the-counter products that you could purchase if you needed something to get you over the hump, say a day before your product was coming. You could also continue to do your fluid flushes, but be careful about saying, well, you know what? I've heard about people using a blenderized tube feeding. Why don't I just blenderize some food today? That would not be my recommendation, because there's much that goes to that, into making a blenderized feeding, including making sure that it is the right consistency to go in your tube. Now, the second thing here then is, I went to sleep and I came, and when I woke up, my tube doesn't seem like it's in the right place. So there's two things to do here. One is to contact your physician, because this may become urgent, and they may want you to say, let's not infuse for a little while. Why don't you come in? They may need you to go to the emergency room. But I know some of you, when I say, is my tube still in the right place, that you see that your tube is in the bed separated from you. In that case, that is urgent and emergent. In that case, you definitely need to go to the emergency room. Let me see if I can move this. Can I move this? There we go. All right. Now, let's talk about some, and I just want to make sure I didn't go too far. No, there we go. Let's talk about some of the challenges that you might have. Now, from a GI perspective, because these, as said, these are likely to come up. I said that previously that I just didn't have any pictures to put in, but I could have put a picture in. So those of you that are on this call, if you really, really want to do some investigation on the consistency of stool, I want you to Google the Bristol, B-R-I-S-T-O-L, stool chart. And if you do, you can see what the definition of stools are that are constipation, quote unquote, normal, and then also diarrhea, as we'll be talking about. So constipation, first of all, it's not routine, but we do need to know what your schedule is. So you may be someone who has been on feeding for a little while, and it's probably every couple of days I will have a bowel movement. If you notice that is you and everything is fine, there's no straining, great, then that's you. That's your routine. But if it changes, that's when you want to pay attention, because it may be urgent. If you haven't had stool for several days, but you haven't had any response to interventions, your physician has given you a product to use for constipation, or you're using an over-the-counter product and you've had no response, this is an urgent call to the physician. Also, if it's associated with a firm abdomen, there's bloating, there's pain, if there's fever, if there's blood in stool, if there's blood in the stool, that's always a call to your physician. If there's, again, abdominal pain, if there's anal pain, these are urgent considerations, and you need to make a call to your physician. You can call your home infusion therapy company your provider, but likely they're going to send you to the same place, which is to your physician. Now, emergent, suddenly there is no ostomy output. There is acute, that means very quickly occurring abdominal distension. There is significant vomiting. This is where you have nothing potentially coming out, but you have vomiting, you could have a bowel obstruction, you could have other things. So in this case, this is emergent. You're probably going to, well, at the same time you're calling your physician, you're probably going to go ahead and go to the emergency room. Well, let's see if I can make it move forward. There we go. Oh, one went too far. Okay, now again, there are pictures for diarrhea. So what is your stool consistency? Your stool consistency may be what your family member who eats a normal diet would say, oh my gosh, I have diarrhea. But diarrhea is typically when it's going to be more watery, no solid pieces, it's entirely liquid. That is not routine. However, this is where you look at, did you change your formula? And maybe you're getting used to this formula. Have you eaten something different? And then does somebody else in your family also have diarrhea? So you could be getting the bug that everyone else has. But in a moment, we're going to talk about how important making sure you're hydrated is. So it's urgent if it is associated with every feed, it's just continuing on. If it's associated, again, here with this abdominal distension, vomiting, fever, blood in the stool, these are things that are urgent. You can speak with your physician. They may give you some antidiarrheal medications to take. Maybe speaking with your dietitian, you may want to slowly but surely change your formula, but this needs to be addressed. It's emergent if it's explosive and you are losing significant amount of fluid. If you also feel like you're decreasing your level of consciousness, you'll see that when we talk next about hydration. And a child that is dehydrated, this is emergent. We can't wait for them to rehydrate through the tube feeding or orally. And now let's go on. Oops. Let's talk about dehydration. I think this is one of those that if you're receiving a tube feeding enteral nutrition, you have to be well aware of hydration, your hydration status. So what are the symptoms of dehydration? I bet if we open this up, you could all tell me what the symptoms of dehydration are. Headache, fatigue, decreased appetite, lightheadedness. So that goes with that changing consciousness, lightheadedness, poor skin turgor. Although, as you know, as you get older, sometimes that skin turgor is not a good representation. And then concentrated urine. So I wanted to spend a moment on that and tell you that I want you to, if you don't already do this, if your provider hasn't given you one of these, then go online and Google dehydration urine color. You really need to take a look at that and be aware of this. So clear, light yellow, you're probably well hydrated. If it's very clear and there's a lot of output, you may be hydrating too much. So be aware of that. If it gets a little more yellow, then it may be okay. That might be the vitamins, but that could be a sign to start paying attention to your hydration. And then finally, if it's getting darker orange or amber colored, that is frank dehydration. And in this case, you need to move forward to adding fluid with your formula, making sure you're getting adequate formula, or treating the reason that this is occurring. Is it the vomiting? Is it diarrhea? Have you just not been infusing enough fluid? Or did you get a new formula that's very concentrated? And so you may have been using the same amount of fluid, but you actually need more. So that's urgent. This is when you need to, again, either call your trusted home infusion provider or call your physician. If it's emergent, those things, poor skin turgor, confusion, dark urine, low blood pressure, no urine output, that's a trip to the emergency room right now. Now, don't forget, you need to rehydrate if you have a fever, if it's a hot temperature outside, if you're exercising, those things that you're doing, and maybe you're doing them because it's like, this is going to help me, but you need to remember, you need to hydrate as well. And then emergent, with a jejunal feeding tube, if this feeding tube comes out, if you have copious amounts of nausea and vomiting, if you have just this continuing constipation, as we've talked about previously, these are emergent. You might, step one, want to contact your physician, but sometimes, and I put in there often, it's important to just go. You don't want to wait. So, who are you going to call? Who not to call? Well, if you have one of these challenges and you get on Facebook to ask your friends, that is not the right answer. You might want to discuss your problem once it's fixed, but you don't want to do that. Do you want to call your friends? No. You might want to call your friends for support. Hey, I think I'm going to the emergency room. You want to meet me up there? No. Your hairstylist? No. Your delivery person. The delivery person may be your best friend and somebody you rely on for your product, but no, you're not going to call them. You want to call your home care company, your DME company, your home infusion company for supply management. And if they have a clinical team, ask if you can contact the dietitian, contact the nurse, or you may want to talk to your physician, because if they are managing your home tube feeding regimen or just the tube, that if your question is on the tube feeding regimen or the tube, you may want to go ahead and call your physician. But again, if your physician is just managing the tube, that may not be it. So with that, I'm going to summarize and say there can be many problems with G-tubes and tube feedings that could just be treated at home. So when the problem gets worse, or you're concerned, call your healthcare provider who placed the tube, call your provider for the product. Emergent problems require immediate attention. Don't wait. And if you have a clinician or a dietitian, call them. If you don't have one, get one. And with that, I'm going to turn it over to Andrea, and Beth and I will be happy to answer questions. So thank you very much for your attention.
Thank you, Carol and Beth. You guys did an amazing job. So we do have some questions. One attendee asked, and so I think this was when Beth was discussing the balloon with the feeding tube. And so this attendee asked, is there a specific kind of water that needs to be added? Normal saline, sterile water, tap water?
That's a really good question. So what I would say is that there's no research in the literature, but what is often the case is that in the hospital, we use sterile purified water, and in the home, oftentimes people use tap water. The purified water means that it doesn't have a lot of minerals in it that could kind of degrade the balloon quicker. But it also costs money to get sterile purified water. So if you do not have that available, we would recommend tap water. That's what most people use.
Thank you. We did have someone ask if you know of a tool or a comparison chart that shows the different kinds of leakage, like color leakage, and then the cause and then the treatment. Just curious if you know of anything like that. If not, we can always circle back to them.
There is an article in Nutrition and Clinical Practice by Abdelhadi, Abdelhadi. I'm one of the authors on it. And it describes that drainage very, very clearly. So it's Nutrition and Clinical Practice. I want to say 2017, but you know, sometimes you forget when you've had something published. But it is a table that is really, really very clearly identifying some of these problems. And you'll see some of the same pictures, by the way, in that article that you saw in this presentation.
Very good, thank you. I will look into that and then circulate that with the attendees. Let's see. All right, can you speak a little bit about dressings under the G-tube bolster and the appropriate dressings to use, which I know can be hard without using names.
So, you know, what I would like to say is that I don't own stock in any particular company dressing. And I'm not against dressings. But what I will say is for a normal looking healthy G-tube, please don't use a dressing. That's number one. If you need a dressing, those little homemade round circles that I used to not like, I actually do like. I just don't put it on if I'm applying something to treat the skin for either a suspected bacterial or fungal infection. I won't put it on right away. Now for redness, silver ion impregnated dressings are very, very good. They lower the bacterial burden because if there is inflammation there, it is either an indication that an infection is developing, or because of that hyperemic, that red state where there's a lot of blood flow, it could get infected. So a silver ion impregnated dressing would be appropriate. If there is drainage with redness, then a silver ion impregnated absorbent dressing would be indicated, meaning a thicker one, something that could absorb it. And then you're going to want to change that every so often. If it is drainage that just seems to not want to go away, there is a dressing, it's pretty expensive, that I used in the past called XU Dry, which, like I said, I don't own any stock in that company, but it really will absorb for like 24 hours and wick the fluid away. What you want to do is get a dressing that will wick the fluid away and not just kind of keep it pressed against the skin. And those little cotton homemade dressings, you want to make sure that you're changing those frequently. Now, if you have no money, and a lot of us don't have a lot of extra money that have healthcare issues, I will tell you that many parents have told me that they have cut up these anytime. And for those of you who are women, you will know what these are. And for those of you who are men and have wives, you'll know what these are, daughters. But they're menstrual pads that you can cut up. They're thin, and slit a Y in the end of it and put the absorbent side down on the skin. And actually they work quite well. And obviously the cost is going to be much lower. Just a little tip, I guess.
Tip. Linda Lord just shared a comment that for her home patients, they use distilled water for balloon volume fill, as it's also purified but free of minerals.
Yes, yes.
All right,
that's
perfect.
Great. Thank you, Linda.
Yes. And then those are all the questions we have right now. Just one, see.
I think a question I have, or a comment I have is I do think that a number of our DME companies, home infusion companies, are starting to have a dietitian. And so what I would say to you as a consumer out there is if you have a question and maybe they haven't introduced you to your dietitian, or you didn't really realize that they had one, don't hesitate to call your home provider and say, even if all you're getting from your home provider is your supplies, go ahead and ask if they have a dietitian that you can meet with or talk to. On the other hand, Beth, your expertise is not something in my practice that I find regularly available to my home enteral patients who find me. Can you tell me how to find a Beth Lyman, a Linda Lord? Can you tell me how to find that, or how a consumer would find that?
Right. Well, maybe not. What you as an audience need to realize is that none of us were born with this information, and there are a number of nurses who are very, very good at treating these problems, and a lot of them have taught me things as well, such as you just heard from Linda Lord with a great tip. So we're out there. I would say that you would contact perhaps maybe Oley or the Aspen office and see if they know of someone. My experience with wound and ostomy care nurses has been very mixed, I'll be honest with you. Many of them look at a G-tube as a wound, and while it has characteristics of a wound, clearly we're not going to treat it quite the same way. We don't want anything pressing on the skin too hard. We don't want any pressure injuries, but it's not quite the same as a wound. It's a chronic opening into the abdomen, and we need to be very considerate of that particular aspect. So it is kind of tough, I will say that.
Yes, I would echo your
I think
thoughts,
so.
Beth, as far as Oley. I feel like, people that are looped in, clinicians with Oley are, more
Yes.
experienced with this. And I'm sorry, Carol, were you going to say something?
I said I agree. And also, I want you to know that I found how to make a G-tube cover free pattern on Google. So, and they're very cute. So I don't know if that's what you were talking about, Beth, but I think there's things you can find to Google.
And we just have one last question. It looks like it's coming from a clinician asking if you have any tips or recommendations for finding out what an individual's provider recommended to address an issue. Example, maybe constipation, if you're their RD. So she knows most people are able to communicate what another provider told them, but miscommunication or misunderstandings could also occur. Are there any questions or ways you recommend addressing this?
I think that the way you find this out is you just ask them exactly what have you used and what has worked for you and what hasn't, because there are some folk remedies out there too, and the provider that they talk to may have not actually been a provider, but the nurse that lives down the street, or their hairdresser. So I think it's just talking to the patient or the patient's family, creating that relationship, even if it's your 1 hour, one time. I think that as clinicians who work in this field of home care, we're quite good at creating a relationship with our patients/consumers and their families. And for me, that has been what I have found. And I do find some things that I'm not interested in the patient doing anymore. However, I think it is, you have to acknowledge it and then say, I have a suggestion that I think might work better for you, because you don't want to criticize them necessarily. They're all trying the best they can. I know with the things that Beth talked about, I'm sure there are many, many theories of how to care for this. Many are not scientifically driven, but I think if we could say, try this might work even better, that is where to go with it. But remember, patients at home, people at home, they are on their own, but they're also having to make they get to make their own decisions. So we're there to guide and provide what we think is the best, quote unquote, practice for them, but they still do get to decide. Beth, any comments on that?
Yes, I think if the question is, as a home care provider, like a dietitian, how do you find out what the healthcare provider at the institution told the patient? And so if that is the question, what I encouraged families to do over time was to use the portal. Instead of calling to report a question, use the portal. Now, even if they call in, there is a paper trail within the institution of recording that phone call, sending it to the provider sends it back to the nurse or the technician to call the family and tell them what to do. But using the portal allows the patient to have written what they should do, because I will say that there are issues with healthcare information comprehension and issues with healthcare literacy that are rampant among all patients of all ages. And if there's any question at all, having it written is the best way to go. So encouraging families to go through their portal in the healthcare system where they're receiving care, and then it is written down. And so it's use Miralax this amount for this amount of time. It's written down instead of them forgetting how much Miralax or how often to use it or when they're supposed to call back. Having it written is a really good way to go.
Thank you so much.
I agree with that. And I think also finding out if they did write that, take this much, quote unquote, we'll use Miralax, take this much Miralax daily, and find out, okay, that may have been what they wrote down. What did they do? Did they think that would be way too much? So they did just half of that.
Yeah. All right, good. Those were all of our questions. Thank you, Beth and Carol, so much for sharing your time and your expertise with us. It was so helpful. And thank you so much to all of those who attended this morning. The recording will be available on our website at oley.org/webinars. We'll also be having our December Community Connection on Friday, December 27th at 6 p.m. Eastern Time. These are a great way to connect with others in the nutrition support community, regardless of where you are in your journey. And then if you're not already, make sure you're following us on social media and receiving our email updates. We have a lot of exciting events coming up, including Feeding Tube Awareness Week in February. So look for that. We'll have a lot going on February 2nd through the 8th. So again, thank you all so much and have a great holiday season. Thank you all.
Happy holidays.
Thank you.